two main systems that we've talked about so far. What arteries come off the common carotid to supply the anterior portion of the brain with blood?
Internal carotid.
Internal carotid. So let me go ahead. So this is another. People have made fun of this one before too, but this is circle Willis from above. Okay, what you see here is if you're looking down at the top of my head, this is a nose, okay, and then two ears, okay, to give you a feel for what's happening. So Alex said the internal carotid. So the other thing that I have to do is I have to tell you that this is the right side, okay, and this is the left side. So Alex said that the internal carotids on the right and left sides come up and supply the anterior portion of the brain with the blood. So I'm going to say this here, keeping with my red color, this is my right internal carotid, and here's going to be my left internal carotid. Okay, and this is my left. Okay, coming off the common carotid, the internal carotid ascends and supplies the anterior portion of the brain with blood. Well, coming off the internal carotid at about the level of the eye, there's a chute that goes forward and then flips over the top of the corpus callosum. What's that one? Does anybody remember what that one's called? Yeah, ACA. So this is going to be, I'm going to draw it right here, coming forward. This is going to be my right anterior cerebral, and this is going to be my left anterior cerebral artery. So that's my right ACA. And this is going to be my left ACA. Okay, ACA stands for anterior cerebral artery. First chute that comes off the internal carotid, both left and right. So you have a left ACA and a right ACA. I tried to draw it in 3-dimension on the sagittal view, but it's kind of difficult. So it's easier to see here, coming off the internal carotid and coming out straight toward the ears. There's going to be another major branch, the anterior circulation system. And that looks like this, coming out straight toward the ears. What does anybody remember the name of that artery, or those arteries?
MCA.
Yeah. This is going to be your right MCA, and MCA stands for middle cerebral artery. Okay, and on the other side, this is going to be my left MCA. So it's a little bit easier to see there. So you have your internal carotids coming straight up and coming forward and then flipping over. You have your ACA, and then coming straight out to the sides, you have your MCA. Hopefully that's a little bit more clear. All right, and then when we talk about the vertebral basilar system, we had left and right vertebral arteries coming up at about the level of the pontomedullary junction to form one main artery that ascends. Which one is that one? Basilar, yep. Here's your basilar artery. It's a little off center, but not bad. Keep that one in green. Okay, that's your main chute. It's going to be your basilar, B-A-S-I-L-A-R artery. Okay, basilar artery ascends up to just above the level of the third cranial nerve in the midbrain. Forms two chutes, and hopefully this is easier to see too. I had some questions about this. These chutes come back and supply the very back of the brain with blood. Okay, and these chutes are, does anybody remember the names of those chutes? Yeah. PCA, right. This is going to be your right PCA. So your posterior cerebral artery, and then this is going to be your left PCA. Left and right posterior cerebral arteries. really helpful to see things from multiple different views so that you have a better feel for orientation and how things are really connecting. Questions about that? Anterior circulation, vertebral basilar circulation back here. Okay, just looking at it from above. Now, connecting the right and left parts of the brain in the anterior circulation, there was one little artery, and it resides here. It connects the both left and right anterior cerebral arteries. Anybody remember the name of that one? Yes, anterior communicating artery. Now you can see it better. Okay, anterior communicating artery forms part of the circle of Willis. It's responsible for connecting left and right ACA, left and right halves of the brain. Coming off the right internal carotid, there's going to be another artery that connects that internal carotid with the right PCA. And on the left side, coming off the left internal carotid, there's going to be another artery that connects the left internal carotid with the left PCA. Does anybody remember the name of those? Yeah, posterior communicating arteries. I heard it. Good. So this is going to be my left posterior communicating artery. And then this is going to be my right. Bless you. Right posterior communicating artery. And there you have it. That's circle of Willis. Now you can see the circle. Right? Pretty clear when you look at it from above. I like the above view better, but I can sort of see it from the side. Okay, circle of Willis is nothing more than blood vessels or vasculature that connects both the left and right halves and the anterior vertebral basilar circulation together. Okay. Questions about circle of Willis? Are the arteries involved? Right? Got a good feel for that? Okay. Almost there. Doing great. We're going to move on to the next part. Now, I already have some questions, so it's good that you guys are thinking ahead. Now we're going to look at the territories or the areas of the brain that are supplied by the anterior cerebral artery and the posterior cerebral artery. And we're going to start here first. So ACA, anterior cerebral, ACA, posterior cerebral artery. What you see here is just the sagittal section through the brain. And what was the name of this thing that's the major connector between left and right halves of the brain? That's your corpus callosum. Corpus callosum. Just a bunch of white matter. Connects left and right halves of the brain. And if I had to label this guy back here, what's that? That's your cerebellum. Good. Starting to recognize my drawing. And again, this is going to be your brain stem in here. And all I'm going to do, I'm going to start with drawing the anterior circulation in here. So you have your internal carotid coming up, right? Internal carotid's coming up. Okay. And about the level of the eye, it's going to form its first major shoot. And that shoot is going to flip over top of the corpus callosum. Like that. Okay. So, so if this is a half of a brain, this is going to be the left half because I've taken the right, sliced down the middle, and I've taken the right half off. Okay, so that makes this the left internal. Does everybody see why I'm saying that? So that right piece I just took off, so I'm just left with this left portion over here. This is going to be my left internal parotid coming and goes over top of the corpus callosum. Okay, now what is that other major chute? This major chute, the second major chute, is going to come off at about this level of the eye as well. But that chute's going to go, I'm going to try and represent it going back here. It's going to come out the lateral surface of the brain. Does anybody remember the name of that chute? MCA. Yeah, that's going to be your left MCA. Okay, and again, it's difficult to represent here. You'll see it more clearly in the next slide, but I'm just trying to represent it coming up and then going straight back down through the table. Okay, and again, this one is your left anterior cerebral. Now let's see where we are. And nothing more than just looking at the sagittal cut right through the middle of the brain, and now we're looking at the medial surface of the brain and what arteries are supplying which parts of the brain. Questions about that? Is that clear? Okay. And as always, we've got the vertebral-basilar system to think about too. So what are the names of those arteries coming up left and right that are going to vertebral, left and right vertebral here coming up to form that one major branch. Okay, so these are vertebral, and the name of that major branch rises just above the level of the third cranial nerve here. Anybody remember the name of that one?
Basilar.
Basilar, yep, that's going to be my basilar. Okay, and again, this is just the left side, so all you're going to say, yeah. Well,
Would half of the vertebral be gone since we're looking at the left side, or?
Yeah, so you could think about it that way. I was just trying to demonstrate it coming up. That's all. Yeah. If you don't want to consider the right part, you don't have to. It's okay. But it coming off the vertebral, the basilar here, just above the level of third cranial nerve, you're going to have that main chute that supplies the back of the brain, and this is just going to be the left side. So remember what that one's called? PCA. Yeah, this is going to be your left PCA. So posterior cerebral. Okay, does everybody see where we are? Nothing more. Now we're going to draw on the territories. And I can tell you that the majority of the medial surface of the brain is going to be supplied by the ACA, as you can see. What happens is shoots off the main anterior cerebral artery right here are going to come out, and it's going to flip around to a little bit of the lateral surface. Okay, so you've got most of it here, and then it flips around to just supply a little bit of that lateral surface. So this is all ACA. Right over the. Does that make sense? You guys good? I heard somebody say, "Wait a minute." So yes, yeah, Mackenzie.
The bottom part where it says the vertebral, is that the left, and then the other one coming the other way, would that represent the right?
Yeah, I had that question too. Yeah, so this would probably be the right, the one that got cut off. I was just showing something coming up, and then the brain is in sagittal section. But if that's confusing, this would just be one of the vertebrals. It's hard to. I was just trying to give you an orientation. Okay. This would be the right vertebral. This would be the left vertebral comes from phase one. Right. That works. Those little hooks are are offshoots of the anterior cerebral artery. Yes, that's anterior cerebral artery. So these little hooks out there, these are arteries coming off the anterior cerebral. They supply all that medial surface, plus a little bit of flip around to the other side. We're going to look at the other side here in a minute. Okay, this is just the medial surface. This is what you can see. And I'm just trying to represent that anterior cerebral artery is coming in and then going around. Okay, so it does a little bit more than just supply this area. It supplies a little bit of the lateral surface of the brain as well. Questions? Do you have any more questions, or is that clear? Is that making sense?
Can you say that one more time?
Yeah. So I don't know what I said. So what happens here is the anterior cerebral artery supplies all the medial surface that I'm coloring in here, plus it flips around to supply a little bit of the lateral surface. So if this part of my brain were gone, then the anterior cerebral artery would supply all the middle, but then flip around a little bit to the outside as well. And we're going to look at a picture of the lateral surface of the brain here in a minute. This is just the medial bisagittal section. Is that more clear? I think there was another hand over here. That was the question? Okay. Does it make sense now? You're going to see that outside here in a minute. You're looking at, this is the sagittal section through the middle of the brain, and you're looking at the blood from the anterior cerebral artery that is supplying that medial surface of the brain with blood. That's called territory. So this is all ACA territory. Okay? So all this plus a little flip to the outside. Just like that. Okay? So you've got that, you've got this in here as well. Okay? So that's all ACA, or anterior cerebral artery territory. That's what I've covered in there. Questions? Now looking at PCA territory. The basal comes up and gives off this left PCA shoot, and then you're going to have PCA territory is going to be a little bit down here. Okay? But then the PCA is going to supply all of the back, all of the occipital lobe with blood. And there's no flipping going over here. It's going on. It's all just straight across. Okay? So this is what you see. The flipping is going to be really important here in a minute. So we'll get there. This is all PCA territory. Is that clear what I'm trying to show? For now? Okay, so the medial surface of the brain, the majority is supplied with anterior cerebral artery. All the back is supplied by posterior cerebral artery. There are things in the middle here that we talked about with the thalamus and the basal ganglia. As a PT, you don't have to worry about that, but it's kind of a mixture, mostly MCA. Then that's not important for what we need to talk about now. Okay, this is what you need to know. PCA supplies all occipital. ACA supplies most of the medial surface. And remember, this MCA is coming straight out the other side, and we're going to look at it here in a minute. Questions? All right, if we're good, now let's look at the lateral, or the outside surface of the brain. Okay. And that's going to be, this last slide here is PCA, MCA, and ACA territory. So you're going to see all three. And this is just the lateral surface of the brain. So it doesn't matter if it's left or right. You can take your choice. But I guess facing this way, it would be the outside surface, because this is the little the temporal lobe. So let's say it's the right side. Doesn't matter. It's both the same on both sides. Okay. A little bit of a review. What's the name of this lobe of the brain? Which part of the cortical region here? Frontal. How about this thumb? Temporal. Great. Now, we talked about a main sulcus right here in the middle. What's that called?
Central sulcus.
That's it. This is your central sulcus. Okay. We also mentioned the name of this lobe of the brain behind the central sulcus. Anybody remember the name of the lobe? Parietal lobe. Okay. And then way back here, we've talked about the back portion of the brain a couple times. Anybody remember what that lobe is called? Occipital. Perfect. Awesome. Now going way back to last week, we also talked about a couple of really important gyri. There's going to be one here in the frontal lobe. It's a precentral gyrus or primary motor cortex. We'll put both. So that's your precentral gyrus or your primary motor cortex. Awesome. Got it? Now, we also talked about another really important gyrus that's located behind the central sulcus in the parietal lobe. Does anybody remember the name of that one? Yeah, that's your post-central gyrus or your primary somatosensory cortex. Great. So this is your post-central gyrus or your primary somatosensory cortex. Again, this is just a review from what we did the other day.
What's the second name again?
Primary somatosensory cortex. Somatosensation. Sensation coming in from your body. Afferent information coming in from your body that you are conscious of goes to your primary somatosensory cortex. Other questions? Okay, I'll ask you a question. What is it about the pre- and post-central gyrus? What's in there? What did we call that thing?
The homunculus.
Homunculus. You remembered. Awesome. So remember, at the very bottom, you've got the head for both the pre- and post-central gyrus. You've got the head. This guy's standing on his head. So you have the head, you have the trunk or the torso. But if you remember, I told you that the feet are kind of sticking over the outside just a little bit. So they go to the medial surface. And the arms are here in the middle. Remember that? So we had, there's the head, standing on his head, trunk, and then the legs flip over a little bit onto the other side, and the arms are in the middle. So the homunculus, somatotopic representation of the body. So those neurons are in a position that's a somatotopic representation of the body, and it's the same for both. Essentially, the post and precentral gyrus, so the primary motor cortex and the primary somatosensory cortex. Okay, so we got that so far. Everybody's good with that, right? Now, we're going to start doing some new stuff. Let's start with that MCA. So I've told you that the internal parietal rises up about the level of the eye, splits into two main branches. First is the ACA. We've already seen a lot of that territory. Then the MCA comes off and then comes to the outside. It actually arises here in this fissure that we talked about. It comes out through this hole or through this fissure. Does anybody remember the name of that fissure? Lateral, this one. This is the lateral fissure. Good. Lateral fissure. So it arises between the parietal and temporal lobes, coming right out of this lateral fissure. Okay? And in blue, I'm representing it in blue, not to confuse it with the the ACA, but this blue color is going to represent MCA. And it doesn't matter. You can say left or right. I think it's the right side of the brain that we're looking at if it's on the outside, if I'm orienting properly. But it's going to be the same for both sides. So do I see Tom saying that? It's the same on the lateral surface for both the left and right side of the brain. Now the big question is, what's the territory of the MCA? In the territory of the MCA, I'm just representing that in blue. Okay, you're going to have a little bit of the temporal lobe here. Okay, and then you're going to have all of this area. This is all MCA territory. I'll put, this is the MCA, and this is all MCA territory here in blue. Got it? Now let's look to see where the ACA comes in. This is all going to be ACA territory here. Remember, this is a little flip from around the other side. This is where that flip comes in. So the red is going to be my ACA, and this is just a continuation from the other side. We just saw the medial surface a little bit ago, but this is specifically ACA territory. More sense now that you see the outside of the brain, so that the red here is ACA territory. Okay. So if I told you that your patient had a stroke that affected their ACA, would you expect their legs to be more affected or their arms? Legs. That's it. It's just that simple. See, because the ACA is the one that supplies the lower extremity portion of the homunculus in both somatosensory and motor. Okay? And it happens. You get a patient with a stroke that affected ACA, you're thinking, uh-oh, they're going to have trouble walking more than they're going to have trouble feeding themselves. All right? But if you get a patient who's got a MCA, are their arms or legs going to be more affected? Arms. Arms, trunk, face, all that's going to be affected. Okay? And that's going to be MCA. That's the difference between the ACA and the MCA. Okay? The last one that we have to put in here, bless you, the last one that we have to put in here is going to be your PCA. And your PCA is just going to, I'll represent it here in green to continue with the other side. Whatever isn't ACA or MCA is just going to be PCA, and the majority of it is this occipital lobe. So if a patient has difficulty or has a PCA stroke, what do you think they might have problems with? Vision. Yeah, they're going to have trouble seeing. They're going to complain about visual deficits. There was one more thing that I just wanted to point out. First of all, questions about that? Do they see how this works now? So kind of, with this class, we're just layering things on top of each other, so you kind of have to remember what we talked about last week, and then we're adding this blood supply now to the basics of the brain. Jonathan?
So territory is all the areas that that artery is supplying blood to. So those are the areas that it is giving blood.
Correct. That is correct. And there's one more thing, thinking about that. So, great question. The territory is the area that that artery is supplying blood to. So, what about here? Does anybody know what's called the overlap region? If I have so all I'm trying to represent is the overlap region here between the ACA and the MCA. It's actually supplied by both. It has a special name. That's called a watershed area. It's kind of like watershed. The water just flows over. So just WATERSHED. That's a watershed area. So in reality, if there's overlap between different arteries, they're supplied by both. That's just termed a watershed. Yes, Alex.
So I know that our exams aren't going to be like drawing this out, of course, and it's multiple choice questions, but would something be like what territory like supplies blood, like the opposite or?
Could be. I don't know. I mean, I can't give you the but it'll get better. Give it like 10 minutes.
Okay.
All right. Okay.
In the watershed area?
Yeah.
Is it that both areas get affected? Is it one or the other?
So, for example, if you had if both areas, that area won't be as affected. If you had an ACA stroke, okay, this area is going to be more affected than this area because this area is also supplied by the MCA.
And is it possible to have a stroke in the watershed area?
It's supplied by both. So you either have an ACA, yeah. So a small stroke is called a Coumadin stroke. So yeah, it's possible to have strokes everywhere.
Okay.
And there's one more point that I did. Oh, wait, Grace, Taylor Grace.
Is the watershed area a general term, like, could it be?
Yes, it is. It's a very general term. Just like to point it out. And I like to give you guys terms too, because when you go into the clinic this summer, you're going to be reading patient charts, and when it says watershed stroke, that's what that means. It's supplied by both, so it's not so bad. And Coumadin stroke is a little stroke. One more point that I haven't pointed out yet, or one more thing I haven't pointed out yet, is if I have a stroke that has affected the right side of my brain, which side of my body will I experience symptoms on? Left. Okay, so you guys know that. So it's contralateral. That's the term. Okay. If a stroke is affected my left side, my right side will be affected, and that word is contralateral. If it were same side, you know the word? Ipsilateral. So ipsilateral versus contralateral. What you need to remember for now, we'll talk about this later, but contralateral, if it's a cortical stroke, if the stroke has affected anything in the cortical region or the brain, the cortex of the brain, symptoms will present contralaterally. Are we good? Yeah? Okay. Let's go ahead and let's take a 10-minute break and then regroup. We'll probably get done a little early. I know you're not terribly upset.